Cancer and its mishaps, why one should not resort to chemotherapy. First, what is cancer? Cancer is a cell mutation when the cell starts to grow too fast. But these aren't like white and red blood cells. They're cells without meaning. They're just a pollution of cells that begins to trap red and white blood cells by growing at an insane rate. This mutation morphs into tumors within the body that weakens the immune system. Now let's talk about cancer within the breast and how breast cancer really works. Breast cancer can accumulate in 3 different areas within the breast. The first being the lobules. This is the milk glands inside the breast. Then the duct. The duct carries milk from the lobules to the nipples. Finally, the stoma. The stoma is the fat holding everything together. Later I will be talking about cancer that my mother had, and just for reference's sake, she had the cancer within the duct. Let's refer back to my title and the argument of my paper. What is chemo and why is it bad? Chemotherapy is the fusion of a multitude of anti-cancer chemicals. These chemicals were born to kill everything, not just cancer cells. As doctors claim, chemo kills more cancer cells than red and white blood cells. It is only because cancer cells are forming at such a fast rate. Although chemo kills cancer cells, it also kills, quite famously, hair cells, and on an extreme level, it kills nails, frails the bones, injures the gastrointestinal system, muscles, immune system, and many more. Long-term effects of chemo are forgetfulness from the brain cells that are being killed from the chemicals, and the chemicals staying in the body for up to 10 years after chemotherapy, and 5 years of treatments to wipe out the chemicals from the chemo out of the system. On top of all of this awful events, there's also an insane amount of debt that comes along with it. Every side of my reference page covered most of all these topics, but what really had me convinced by all of it was having to experience it myself. My mother went through cancer 2 short years ago. The picture on the right is her after having started chemo. My mom has always been insanely strong and will never admit when something's wrong. When she was going through chemo, she forced herself not to let it change the way she lives. But now that it's over, she was able to open up to me about what truly went on. After starting chemo, my mom, as you can see, lost her hair within her eyebrows, her eyelashes, her fingernails became insanely frail, along with all the bones in her body. She went from 130 pounds to 110 within the first month. She was 38 when she was diagnosed, and she had to go through chemo 2 times a week on top of taking medication such as steroids just to keep her strong enough to keep fighting. All the medication kicked her into early menopause. She says everything that was going on made her insanely forgetful, and she still can't remember a lot of what was going on through going through chemo. Now she has 5 years of weekly doctor visits and an overload of daily medication to wipe out the chemo out of her system, along with about $36,000 of debt. My mom had stage 2 cancer, which is only 93% curable in today's age. A doctor shouldn't have jumped into chemo when trying to cure cancer with my mom's case. And let me tell you about them. Them being alternate cures. First, surgery. Surgery never sounds fun, but when dealing with breast cancer, I will always suggest surgery first. Surgery cuts out the area of the tumor within the breast and doesn't affect any other part of the body, and it won't leave you $36,000 in debt. With this, a new law was passed a few years ago allowing doctors to use implants to match breast size of the patients with no additional cost, which is super cool. Next, radiation, the process of using high-energy X-rays to kill off cancer in the given area. This is a 15-minute process daily that lasts 5 to 6 weeks. The first 4 weeks focus on the exact area of the cancer to kill it off. Then the next couple weeks radiates the surrounding areas to make sure that there isn't any cancer left over. The x-rays are very hot and will eat away at the skin. However, doctors prescribe a lotion that prevents that from happening. Last, sentinel lymph node removal. This is the process of removing lymph nodes affected by the cancer. This is fast and easy surgery, and removing cancer, however, can leave the patient without long-term numbness and of the area removed. Although none of these sound fun, the patient with so many long-term effects from chemo could probably say that an alternate route before resulting to chemo is better, such as my mom. If you are being affected by cancer, you have options. And if you are not in the top stage, like 3 and 4 of chemo, you should not resort to chemotherapy right away. If you are not being affected directly by cancer, spread the word. The word of mouth is so, so powerful. And if you use the evidence provided within my paper, you can prevent somebody from going $36,000 in debt or suffer unnecessary suffering. We can all help make cancer patients live just a bit easier by the word of mouth. So please, spread the word.